Enoxaparin. Anticoagulant medications. 1981 and approved for medical use in 1993. Enoxaparin is made from heparin, low molecular weight heparins. Other medicine in enoxaparin class: dalteparin, fondaparinux, and tinzaparin. Medical uses: 1. Treatment of unstable angina UA and non-Q wave myocardial infarction, NMI, administered concurrently with aspirin. Unstable angina is chest pain that is sudden and often gets worse over a short period of time. 2. DVT prevention in knee replacement surgery. 3. DVT prevention in hip replacement surgery. 4. DVT prevention in abdominal surgery. 5. Treatment of DVT with or without pulmonary embolism. 6. Treatment of DVT in patient with street segment elevation, myocardial infarction STEMI. Note: deep vein thrombosis. DVT is the formation of a blood clot in a deep vein, most commonly in the legs or pelvis. Side effects of enoxaparin: 1. Thrombocytopenia, that is, can be associated with heparin-induced thrombocytopenia of persons treated for at least 5 days. 2. Elevations in serum aminotransferases. 3. In people undergoing abdominal or colorectal surgery. Bleeding, anemia, ecchymosis. 4. In persons undergoing hip or knee replacement. Fever, nausea, anemia, edema, peripheral edema. 5. In people being treated for deep vein thrombosis. Injection site hemorrhage, injection site pain, hematuria. Contraindications of enoxaparin: should be used with extreme caution in conditions with increased risk of hemorrhage, such as bacterial endocarditis, congenital or acquired bleeding disorders, active ulcerative and angiodysplastic gastrointestinal disease, hemorrhagic stroke, or shortly after brain, spinal, or ophthalmological surgery. Dosage of enoxaparin: the defined daily dose is 2,000 units. Dose equivalence and conversion: 1 mg equivalent to 100 units. Enoxaparin use in pregnancy. Not known to be harmful. Low molecular weight heparins do not cross the placenta. Multidose vial contains benzyl alcohol. Avoid. Monitoring requirements: heparin-induced thrombocytopenia. Platelet counts should be measured just before treatment with unfractionated or low molecular weight heparin, and regular monitoring of platelet counts may be required if given for longer than 4 days. Hyperkalemia. Plasma potassium concentration should be measured in patients at risk of hyperkalemia before starting the heparin and monitored regularly thereafter, particularly if treatment is to be continued for longer than 7 days. Cautions: elderly, risk of bleeding, severe hypertension, low body weight, increased risk of bleeding, obesity, increased risk of thromboembolism. Unlicensed use of enoxaparin. Not licensed for treatment of venous thromboembolism in pregnancy. Mechanism of action: enoxaparin binds to and potentiates antithrombin, a circulating anticoagulant, to form a complex that irreversibly inactivates clotting factor XA. It has less activity-agent factor E, a thrombin, compared to unfractionated heparin of due to its low molecular weight. Thanks for watching.